I remember the moment clearly. It was my third year of medical school. I was following a nephrologist in the clinic, and as a third year medical student, you're very impressionable. You haven't had much clinical experience. You've been basically in the books, in the library, taking tests the first 2 years of medical school. And I remember seeing two patients in a row with the nephrologist that really was illustrative for me in terms of how important an activated, engaged patient is. The first patient, actually both patients were pretty similar. The first patient was about a 68-year-old lady. She had chronic renal insufficiency. She had high blood pressure. She had hyperlipidemia. And she was on probably about 7 or 8 medications, of which she knew none of them. She knew that they were the little yellow pill and the little pink pill, and she didn't really know the doses. And you could tell that it was really difficult for her to understand, number one, exactly what was going on in her medical care, and number two, it was very distressing as a medical student to recognize that this woman didn't have a good grasp of why she was being treated for certain conditions. And God forbid something were to happen to her and she were to go to the emergency room, or she wouldn't even be able to describe what medication she was on. And so she was, I think, the example of the non-participatory patient. Well, somewhat participatory, but she didn't have the tools or the wherewithal to be able to understand exactly what was going on. And I think that for her, I felt like I needed to create a better tool or a better system, or somehow get her involved and activated. The second patient was right after her. This was a similar patient, except it was a male patient. I think he was in his 50s, but he had pretty much the same conditions. Chronic renal failure or chronic kidney disease. He had high blood pressure. He had hyperlipidemia. The difference was that for the past 11 years, this gentleman had been tracking his own blood pressure and mapping it on a spreadsheet, so you could see trends up and down. And along with those trends, he was mapping exactly what medications he was on at that time. Now, I'm not suggesting that everybody and all patients have the ability to do this, nor should they do this. But what I'm suggesting is that he was the example, the epitome of an activated, engaged patient. And the doctor-patient relationship between him and his nephrologist was such that if he had a high blood pressure reading, he would just get on the phone or send an email to his provider, and they knew exactly what was going on. They trusted him because he was so activated. And I think that that relationship was definitely a very good one. And that, for me, those two patients in particular, right back to back, was exactly sort of when I realized the power of an activated, engaged patient.